This is a portable chest radiograph of a young man who presented with chest pain and shortness of breath following a gunshot wound to the back. The film shows multiple metallic bullet fragments projected over the right hemithorax. There is marked leftward displacement of the mediastinum and cardiac silhouette, indicating a significant tension effect within the right pleural cavity. The right upper zone appears relatively opaque, while the right lower zone is more lucent, giving a mixed pleural density pattern. There are also areas of pulmonary contusion and laceration adjacent to the bullet fragments. Overall, these findings are consistent with a large right-sided tension hemopneumothorax. The increased opacity in the right apex represents blood layering dependently within the pleural space, while the lucency in the right base represents air rising to the least dependent portion. This combination of air and fluid within the pleural cavity gives the mixed appearance and distinguishes a hemopneumothorax from a simple pneumothorax or hemothorax. The key feature here is the mediastinal shift to the left, confirming tension physiology. After thoracostomy tube placement, the mediastinum returns to the midline, confirming decompression of the pleural space and resolution of the tension component. Although the mediastinal shift might initially suggest a tension pneumothorax, the mixed pleural densities are more typical of either a tension hydropneumothorax or a tension hemopneumothorax. Given the history of penetrating trauma and the increased attenuation due to the presence of blood, a tension hemopneumothorax is the correct diagnosis. Hemopneumothorax typically follows trauma and can result in tension physiology, particularly after penetrating injury, which is more likely to produce this than blunt trauma. The radiographic appearance can sometimes be confusing because the increased density of the pleural blood reduces the overall lucency of the pneumothorax. When the patient is supine, the fluid layers dependently at the apex and the gas rises to the base, accounting for the appearance seen on this film. This is a life-threatening emergency requiring immediate drainage with a thoracostomy tube. Following drainage, further imaging is obtained to assess re-expansion of the lung and evaluate the extent of injury. The quantity and rate of blood drainage guide further management. If the initial drainage is large or the rate is brisk, surgical thoracotomy may be indicated to control bleeding. In summary, this is a traumatic right-sided tension hemopneumothorax secondary to a gunshot wound, producing mediastinal shift, mixed pleural density, and associated pulmonary lacerations. This is a critical diagnosis requiring urgent decompression and close surgical assessment.